coverage, the government-mandated one-size-fits-all plan, which will cost about twice as much as what many employers currently offer. So some employers are going to say, I can't afford that, I'll pay the penalty instead. Other employers are going to push workers down to part-time status to evade the law altogether. But if you're dropped at work, it doesn't mean you're going to be uninsured. You're not going to have that option because when you file your taxes, you're going to have to attach proof that you are in a government-mandated plan.
Wow.
So you will, if you earn too much to be eligible for Medicaid, you will have to go shop on the state health insurance exchanges.
So these health insurance exchanges, we were talking in the commercial break, a lot of this is rolling out now. It's kind of
They'll be open in October.
They'll be open in October.
And most people have never heard of these, but they're like an 800 number, a website, and a DMV type office. And they only sell the government-mandated plan. It's like going to a supermarket that only sells cereal or a car dealer that only sells four-door sedans, no hatchbacks, no convertibles.
Right. So they dictate what you're going to get, is your point number 3, right? They dictate exactly. I thought that Obamacare was supposed to give us more choice, or at least what the president always said is you'll be able to keep what you have.
No, there won't be more choices. There really will be no choice. There'll be bronze, silver, gold, and platinum, but all those plans have the same benefits. Only the copays and deductibles differ.
Okay, now the government will dictate how doctors treat patients. What do you mean by that?
That's right. Section 1311 puts the federal government in charge of your health care for the first time. Even if you have a private plan you paid for yourself, the Secretary of Health and Human Services can still dictate what doctors do, what kind of information they collect from you, and what kind of treatments they provide.
I know you're concerned about doctor shortages as well, but let's talk about seniors. They're going to get less care?
They're going to get less care because, believe it or not, cuts to Medicare pay for more than half this law. So the chief actuary of Medicare warned that some hospitals will stop accepting Medicare. Where will seniors go? Other hospitals will have to spread nurses thinner to make ends meet. And on average, according to the actuaries, a senior will get about $1,431 less care per year by the end of the decade than if the law hadn't passed.
And that's scary because there was already an issue about doctors not taking Medicare,
It's
right?
going to get worse. And worst of all, probably, the money that's not being spent on seniors, it's going for bureaucracy. The spending on government administration, bureaucrats telling doctors what to do, is going to soar from $28 billion to $68 billion. So, unfortunately, not money to make people better or to prevent illness.
Wow. If you want the easy-to-read guidebook on what may be ahead, check out Betsy McCoy's new book, Beating Obamacare. Thanks for explaining it so well to us.
Principles of health care in this nation that Americans describe, not one of them are improved by the intrusion of the federal government. Not one of them will be improved by this bill.
Well, that was Georgia Congressman Tom Price back in 2009 warning Americans about Obamacare. And so where does the congressman stand today as an orthopedic surgeon himself, who's also a congressman? He joins us right now. Justify.
Yeah, well, this bill never worked from a financial standpoint. You know that, I know that, and now the American people know that.
But now it has no hope without a mandate.
But, well, and you're right. You're absolutely right. But the fact is that we can solve these challenges without putting Washington in charge. They're wonderful solutions. The way that you make the pre-existing illnesses and injuries work is so that you allow people in the individual and the small group market. Those are the only folks that are really affected by the pre-existing illness problem. You allow them to pool together with millions of other Americans, so you get the purchasing power of millions. That makes it so that the pre-existing illness and injury argument goes right out the door. Under 26-year-olds on their parents' insurance, the insurance companies have essentially said, look, we understand that those folks don't cost much anyway, and we're going to keep them on the plan. So we can solve these without putting Washington in charge.
But,
This is a Fox News alert. You could soon be paying a whole lot more for your health insurance. It's a brand new hour of America Live. I'm Shannon Bream in for Megyn Kelly. The National Business Group on healthcare saying that healthcare costs for big companies are expected to jump 7% next year. That, of course, could mean higher premiums and more out-of-pocket costs for you. In fact, 6 in 10 employers in the survey plan on increasing the percentage their workers are going to have to cough up for their premiums. That's you and me. So that paycheck could actually wind up shrinking. We're going to check in just a moment with Charles Payne of the Fox Business Network to talk more about that and some other interesting details that were tucked inside the study, because it all gets down to how much you'll have to pay for in-network doctors, out-of-network doctors, out-of-pocket costs. Charles is there now. Let's check in with him. Charles, I want to get your reaction to what we're hearing out of this brand new survey this morning.
Well, I think it's a confirmation of a lot of things that we've heard for a long time. Keep in mind, right now, our economy is growing at less than 2% a year. So if you start to think healthcare costs are going to be 7% or more, then to just put it, according to the CEO of the study, that's unsustainable. That is a massive, massive hit to large businesses, and they have to make adjustments, including, not hiring people, raising prices, and delaying big-time projects.
Well, for the rest of us who are worried about, paychecks and people out there who can't even find a job or get a paycheck, how will this impact the overall specter of hiring and the fact that employers know that it's going to cost them for every single person they have on benefits? Does it impact how many they hire? Does it impact their choice to take away those benefits altogether?
Absolutely, in both cases. And it also impacts the quality of these. Listen, this mandate sort of says that, people have to be covered. It doesn't really say a lot about how you cover their spouses, how you cover their dependents, how do you cover retirees, particularly now early retirees. There are a whole lot of question marks in there, and there's absolutely no doubt that this is going to hamper any sort of efforts to hire. Listen, from large to small, this, of course, is a survey of large businesses, but we've heard it from small businesses as well. And even though the Supreme Court said it is a tax and it can indeed be levied against businesses, the fact of the matter is no one's really sure how they're going to deal with it. But we do know one thing that's crystal clear. The cost curve does not bend down. It continues to bend higher.
All right, so you mentioned it, and to note for folks, 82 of the largest corporations in the United States are the ones behind this survey. You mentioned small businesses as well. We know we've heard a number of small businesses, and we've seen polling from them as well from the National Federation of Independent Business, that they're very worried, primarily because of uncertainty. But now we have numbers showing that we know, at least in part, that costs are going to go up. Are you saying that even larger businesses aren't insulated from these spikes?
Oh, absolutely not. You're going to see some large businesses maybe just push a certain portion of their employees into exchanges. Some may try to figure out other ways around this. There's still a whole lot of question marks. There's really very few businesses out there that I think exactly know how they're going to deal with this. Everyone knows one thing for sure, though, that costs are going to continue to go much higher. And remember, for the majority of businesses, large and small, their number one expense happens to be employees. You start to heap this on top of it, healthcare growing at 7%, and that means something has to give, and typically that means less hiring, and ultimately it could even mean more expenses for all of us, the end user of those consumer products and services.
Well, you mentioned the state exchanges, and there are a number of states saying they're not going to take part in that. We know the federal government can step in then in some of these cases and set up the exchanges anyway. So is it your best guess that despite the promises otherwise, folks may not be able to keep their doctor or their insurance they have now?
You're absolutely right. Even with these large businesses, a large portion said, we're probably going to end up putting a significant portion of our employees on these exchanges. And these exchanges, that's when you're really going to see separation. We're already seeing in some cases, where, and you hate to use the R word, but that's indeed what it is, rationing of care starting to come into play. And with these exchanges, you're not going to probably keep the doctor that you're used to, that you're accustomed to, that you're comfortable with. And that was a large fear that the public, by the way, always had and got right.
All right, Charles Payne, always good to see you. Thanks for helping us break it down.
And some troubling news for millions of Americans who get health care benefits through their jobs. There's a new survey out, and it claims that 1 out of every 10 employers plan to drop health care coverage for their employees in 3 years when the key provisions of the new health care law really begin to kick in. So 1 in 10 would stop covering employees, according to this survey. Peter Ducey joins me now. He's in Washington. So, Peter, how many people would that impact?
It's hard to say specifically, but potentially millions of people who get their health insurance at work, because the consulting firm Deloitte says employer-sponsored health insurance covers more than 160 million Americans. And when they randomly asked 560 employers with 50 or more workers what's going to happen with their health insurance coverage in the next 1 to 3 years, 9% said they anticipate they'll drop it. A vast majority, 81%, said they anticipate they'll keep it, and 10% said they're just not so sure. But that's not all, because under the Affordable Care Act, there's a set of health care categories that must be covered by certain plans starting in 2014. It's called the Essential Benefits Package. And 34% of employers say that if the benefits in that Essential Benefits Package are more generous than the ones that they're providing, then they'll also consider dropping coverage. Martha?
Well, so many businesses have seen their health care coverage costs rising in recent years by numbers that don't keep up with the pace of inflation or anything else. So they've been making those changes and those considerations. And the president said if you liked your health care, you could keep it. Brings all that into doubt as well. How far out does this study go in terms of seeing the future trend in all this?
It's interesting. They give it some historical context. Listen here to what the director of their health services department said.
Well, at the beginning of the decade, 70% of companies provided health insurance. At the end of the decade, it's 60%. So would 10 years from now that be at 50%? Probably. Are there questions about whether the Affordable Care Act reduces cost? Yeah, that's what the employer said. I know it's covering a lot of folks, but does it reduce cost? We're not so sure.
And keep in mind that not too long ago, the Congressional Budget Office estimated that only 7% of workers could lose their coverage in the next decade under the Affordable Care Act. So this new number, 9%.
Hey, Diane.
Hi, Ainsley. So actuaries at management consulting firm Oliver Wyman say an Affordable Care Act provision linking prices for older and younger patients could mean a more than 40% premium hike for some policyholders. That's because the law says insurers can only charge older people a maximum of 3 times what they charge younger people. As a result, the report forecasts individual policyholders aged 21 to 29 are looking at a 42% hike in premium costs, while those in their 30s can expect to pay 31% more. Added up, and the study's authors say almost 4 million people will pay more out of pocket for insurance than they would without the law, even if you account for premium assistance. Supporters say the restriction ensures seniors are charged fairly, but critics say the requirement will just lead young adults to forego health insurance and pay the comparably small penalty for not having it instead. Now, that's a big problem because the higher cost for younger policyholders balances the lower cost for the older ones. So if young policyholders start dropping out, prices go up for everyone. And the report adds that eliminating health status as a rating factor may also increase premiums by about 20% for those with lower than average health risks, which also would largely affect younger policyholders. So while it's already started going into effect, Ainsley, it definitely seems like there's still a few things left to iron out when it comes to the Affordable Care Act. And this study's published at contingenciesonline.com for those who want to read more.
All right. Thank you, Diane.
Thanks.